pain, shortness of breath, what are you going to do? What's one of the first things you're going to do in your assessment?
Assess airway.
Okay, assess airway. What else are you going to check? Vitals. What else? Oxygen level. What else? Dyspnea is shortness of breath. All right, but what are you going to do? You need to do an assessment, and how are you going to do an assessment? You're going to gather the data, but what's another thing you're going to do that nobody has said yet? Lung sound. You want to auscultate, right? You want to auscultate. Okay, you know what a upper respiratory infection is? Make sure you know it. These are all multiple choice, but make sure you recognize what URI, upper respiratory infection, is. How do you know if somebody has a cold, and what's one of the first things that can happen to them that makes you realize that they're developing complications? They develop, is it stuffiness?
Shortness of breath.
That's a cold, right? Okay, shortness of breath. Sure, what else?
Secretions.
Okay, secretions, what else? When you've got, what
Fever.
is a fever? Somebody has scratchy throat, stuffy nose, sneezing, lots of mucus. That's what a cold is all about, right? But if they start developing shortness of breath and they start developing a fever, we know that there are some complications that may be occurring, right? Why is it that most doctors do not want to give people who are complaining of a cold antibiotics? Because of the virus. Now, can that virus? No, I got to tell you, though, sometimes they do give antibiotics even for viruses. All right, they do. They have found it to be somewhat effective, but it's usually because it's a virus. Does that mean if the doctor says it's a virus that it will not develop into something that you may need antibiotics later? No. You have sinusitis in your maximal sinuses. Where is that located?
Cheeks.
Okay, somebody has pharyngitis. What's another name for that? Layman's term. Sore throat. Sore throat. The doctor orders the culture of that sore throat. What are you going to use for that, to get that culture? Is it going to be a clean, a swab, a sterile swab, an ear tip? What are you going to use? Does it have to be sterile?
No. Yes.
Why does it have to be sterile?
Other bacteria.
Because of other bacteria. It's got to be a sterile swab. Because you don't want something that's already on the swab growing, you don't know in the throat or where. So it must be a sterile. Oh, you're not going to be very happy with this. Who's this again?
I tried something off like a year ago, but
What's this cardio quiz?
that's probably it then. Probably. I'll turn it off the other later.
Well, you know what? It looks like there are, well, this is about pyelonephritis.
Oh, it's not.
It's not yours. Anyway, there you go. Thanks. Okay, if somebody has laryngitis, what's the treatment? No talking. Right, rest your voice, right? However, if that lasts for longer than how many weeks? 3. That's not how many fingers I have up.
Oh, I'm sorry, I didn't see your fingers.
Okay. 2 weeks, then they need to go see a doctor because they may have throat cancer, laryngeal cancer. Okay. And what is the name of the procedure, or what is the name of the instrument they use to check down there? Laryngeoscope. Yes. Kirsten, you have a question?
So sore throat and strep is like this. Is it the same thing?
No. Strep throat is strep, but sore throat can be caused by a lot of things. Just even postnasal drip. Did you know postnasal drip can cause a sore throat, a really terrible sore throat? Not only that, it makes you hurt your stomach. You have that jump going down your stomach. So what's the treatment for that? Somebody says, you've got a sore throat and I feel sick to my stomach. You say, do you have postnasal drip? And they'll say, yeah, I do. So what are you going to give them? What do you tell them to take? Okay, antihistamine. Antihistamine.
I'm the dry out.
something's dried up. Of course, you would, if you ever give that kind of advice to somebody, you always want to make sure that you let them know that, first of all, find out their allergic to. And second of all, just say, well, you know, if you bother me, remember this to your doctor, but the antihistamine might help. But you want to be very careful because remember, you don't want to diagnose. Okay, what can it cause? What's one of the side effects it can cause? Drowsiness. An antitussive, Robitussin AC has codeine in it. Remember we said codeine is an antitussive, right? So what does that, why would you be giving somebody Robitussin AC or the codeine? Why would you be giving that to them? To what?
Stop cough.
To stop the cough. What else do we give codeine for? Not the Robitussin AC, but we give codeine for pain. But Robitussin AC is given for cough suppression, okay? If anybody gets this wrong tomorrow, I'm going to really be mad. Okay. You are telling somebody that they need to give themselves 5 milliliters of this cough medicine. And, well, you know, they don't have these little cups to measure 5 milliliters. So what is equal to 5 milliliters if they get 1 teaspoon? Okay. How many milliliters in a tablespoon? 15. So if there's 15 milliliters in a tablespoon, then how many teaspoons are in a tablespoon? What's one of the things that you can do to help people, like you're trying to get a sputum specimen, what's one of the things that you can do to give them, to help them to be able to cough that up? What's that? Okay, do it in the morning, but what can you do for them, give them, to help them to be able to cough that up?
Some water.
Okay, an expectorant, but what else? What?
Water.
Water. Water. You want to encourage water to help liquefy those secretions so they can get them up. And into that. Okay, somebody has a partial non-rebreather mask on. Do you remember the non-rebreather? I think Ruth Franklin had it on there. Not the Venturi. This one has a bag under it. Remember, the non-rebreather has a bag under it. Is that bag supposed to be inflated or deflated? Inflated. If it's deflated, what are you going to do? You're suffocating them. You need to take it off, and you need to call a respiratory therapist immediately. Okay? You're doing your assessment on your patient, and let's say your patient's comatose, so they can't tell you anything. So what's going to make the determination that this patient needs to be suctioned? By hearing it, which way though? I mean, you might be able to hear it this way as well, but he can't tell you. Let's say you're not hearing anything auditory with your ear. But what's the other way? Part of your assessment. You should be doing it every single patient. What? Lung sounds. If the lung sounds sound wet, then he needs suctioning, right? Does that make sense? You know, you go do your assessment on people. Remember, you should always be checking the lung sounds, whether they're in with a respiratory problem or not. If they're in there with any problems over there, you still check your heart sounds and your lung sounds. Okay, before you suction your patient, what is it you're supposed to do with him? Hyperventilate. Use that bamboo bag and give him some extra breath. Hyperoxygenate him. Because why? When you're going to go in and you're going to steal his breath away while you're suctioning. Which reminds me, when you go down, when do you do the vent? While you're going down or when you're coming back up? When you're coming back up. How long should you be down there for? No more than 10 to 15 seconds. No more than 10 to 15. Okay? And then what do? You come up, you include as you're coming up, or do you plunge it back and forth, or do you rotate and twist? What do you do? Okay, rotate and twist. And then as you're going down, when's the best time for you to occlude the suction let's say you don't get that, let's say you're just got a lot of junk and you don't get that. When's the best time for you to include that? When you're starting to come out. Okay, I'm going to come out now. Now you're going to include it and pull it out. Makes sense, right? This stuff is just common sense stuff. Now, it's really nice if you can do this, and that is if you can find a pulse oximeter and put it on somebody while you're suctioning them. That way, because in the perfect world, it would be nice, so that way we can see whether they are deoxygenating while we're suctioning them. Not that we're going to be down that long, and we're talking about 10 to 15 seconds. Although, when I do that, it just, kind of freaks me out. Because I hold my breath when I go down. Start, I hold my breath. So I have an idea of what they may be going through. But anyway, it's important then for us to, if you have it, if you can, to do a pulse oximeter on the person while you're suctioning them. Okay? Amy, you have someplace to go? I saw you look at the clock. Do you not have any watch? Oh. Okay. That way you can look at your watch screen and you wouldn't notice. When you turn around and I noticed that. Okay, somebody who has rhinitis, what's an important way to prevent cross-contamination? Wash your hands. Cuffed trach tube, what does it do? What's the cuff of the tube do? The cuffed trach tube, what does it do? It does not hold it in place. It's not do the work purposely. It's keep the secretion from being aspirated. Okay, inflammation of the nasal mucous membranes. What's the name for that? Inflammation of the nasal mucous membranes. Nasal mucous membranes. Close. Sinusitis. Very good at that. What is one of the three primary conditions leading to nasal obstruction? You should know what that is. What's one of the three leading causes of nasal obstruction?
Counselor.
Polyps.
Go, you guys can find it out. Okay, what sinus is most affected by sinusitis? The maxillary. Who is most prone to developing sleep apnea? Okay. And then you have a matching where who has their workbook? Is that your workbook or that's okay?
What was the last one? The third three things? What?
I'm recording.
Huh?
I'm recording.
Okay, what's one of the major causes of nasal obstruction? And somebody said it earlier, but in the other question it wasn't the response I was looking for. Nasal obstruction. Polyps. Fractures of the nose is considered to be a cause. No, it's not minor. It's caused by direct trauma. When somebody punches you in the nose. I'm sorry. Change that to blunt trauma. Laryngeal fracture or laryngeal trauma is usually caused by direct. Laryngeal trauma is usually caused by direct trauma. So we're talking about some causes of like a nasal fracture is going to be blunt. Somebody hits you like in the nose with a fist or something like that. That's considered to be blunt. Laryngeal, you get hit by what do you think? if you get hit by?
Zero.
Zero. And that's considered to be direct trauma. And then obstructive sleep apnea is can be caused by a reduced diameter of the upper airway. And what's one of the major causes of epistaxis? What's that? Dryness. Yeah, dryness is very good. What else? Something that people do. Not to blow their nose, but pick it. Picking the nose can be a cause of epistaxis. That's all you should know. Okay, what are some of the physiological and emotional effects of sleep apnea? Tell me. Somebody has sleep apnea. They'll wake up in the morning and they will have a headache, and they will be tired, and they will be moody, grouchy, irritable. Can they develop heart problems from that? Yes, they will. What about, are we going to be able to focus?
No.
Not really. It's hard for them to focus. Hard for them to concentrate. Diarrhea is what? Hemoptysis is what? Blood in your sputum. Polysomnography, what is that? Polysomnography.
What is sleep?
It's a sleep study. It's a sleep study. Coryza is what? Yeah, common cold. Stridor is what?
Struggling to breathe.
What's that?
Struggling to breathe.
Yeah, it's hard to breathe. It's a harsh respiratory sound. Kind of sounds like maybe even a seal barking. Okay. Aphonia is what? Loss of voice. Very good. Somebody has a thoracentesis. Remember we talked about that, that going to pull out blood or fluid or whatever, or air. And they have a thoracentesis, and why would we need to order an x-ray afterwards, a chest x-ray? Yes, to make sure we didn't give a pneumothorax. A pneumothorax is air in the lungs, in the lung cavity. A hemothorax is blood in the lung cavity. We'll be talking about that a little bit today. Okay, if somebody has a nasal fracture, what's one of the things that can occur due to a nasal fracture? They can end up with what? Deviated septum, which can cause what? Think of your airway. What can it do to your airway? Nasal fracture. Yeah, it can include your airway, your upper airway. Okay. Somebody who has laryngeal surgery, a lot of times they are malnourished, or they will become malnourished because they don't want to eat. And one of the reasons they don't want to eat is because they have like a bad taste in their mouth. Everything tastes bad. What's something that we can do for them to help them with that? Mouth. It's amazing what mouth care can do for somebody. We're just about finished here, guys. What does morphine do to your respirations? It depresses it. So if somebody has 4 breaths per minute and they would need something for pain, are you going to give them some morphine? No, not unless you want to kill them. Okay, so there are 50 questions and there is 1 extra credit question. And that is it. Any questions on that? What's the extra credit?
Can you go back over the one you said after the poly, whatever, you went super fast and I got the poly sonography one, and then I got Strider, and I didn't get what was in between that.
One of the primary reasons for nasal obstruction is, and somebody said it was a deviated septum. Sinusitis, what sinus was most affected? is found in,
Oh, way past that, I got all that in there.
where the word, yeah, you said Colleen, some not, oh, I'm sorry, okay, there it is again. Forza is what? Strider is what? Hard to breathe. Hard to breathe, actually, it's a central airway obstruction. Aphonia is X-ray done for thoracentesis to see if somebody with a nasal fracture may have occluded upper airway. And then as far as somebody who's had laryngeal surgery, you want to provide what for them? So they know.
I got all that, thank you.
All